Reimagining Rural Health, a podcast series brought to you by Sanford Health. In this series, we explore the challenges facing healthcare systems across the country, from improving access to equitable care, building a sustainable workforce, and discovering innovative ways to deliver high-quality, low-cost services in rural and underserved populations. Each episode examines how Sanford Health and other health systems are advancing care for the unique communities they serve. In this episode, host Courtney Collin with Sanford Health News talks with Christopher O'Connor, CEO of Yale New Haven Health System. Christopher is a speaker at the 2024 Summit on the Future of Rural Healthcare.
It's a delight to be here.
Yeah, good to meet you. Leading through change, driving innovation and collaboration to strengthen access, quality, sustainability was a panel that you participated in this morning here at the summit. I'd love to know a takeaway or two that you wanted to drive home.
One of the things I walked away with is that really, regardless of where your environment is, rural, urban, the challenges that we are facing and potential solutions are pretty ubiquitous. And that's where the collaboration and working across, I think the field is going to be really essential to drive that change and to drive improvements that ultimately benefit, as Bill said, eloquently, around the patient at the center of that change.
What has been your most surprising, hottest take, or something that you're looking to take away from the dialogue today?
Well, I think that obviously listening to Sharif and hearing about the veteran structure is obviously a very different component to what I think Bill and I are used to dealing with. And so hearing some of those challenges is sobering, but also really invigorating to know that you have people like Sharif who are trying to drive that change and improve the health of the veterans. And I think Bill and my perspective is a little bit different in our communities. And so I think that was a big takeaway for me.
What do you think is the biggest misperception about rural America?
Well, I think first that there's no care, and you have great entities like Sanford that are out there providing care and enabling the technology and the access that I think people need and deserve.
How do we strengthen trust in healthcare during this time of rapid disruption? What do you think?
I think that I still believe there's enormous trust, that the sanctity of the relationship between the provider and the patient is still sanctimonious, is still the premier driver of what trust is all about. And so I think as a health system, our job is to support that relationship, enable it to have one, immediate access or one, appropriate access, and two, different mechanisms to gain access to that trustful relationship. So whether it's in person or whether it's via virtual systems, we support that technology.
Thank you. Let's talk about AI in healthcare for a moment. What do you think? Overhyped, real? Where do you stand on how it's impacting healthcare?
Well, it certainly is the bright, shiny object of the day. But no, I absolutely believe it's real. I mean, we have implemented a Bridge, the ambient listening software that has really done wonders for physicians and creating these amazing comprehensive notes that have just tremendous value and efficiencies to providers, but it's not going to solve everything. And so while it certainly is a technology we're going to gain a great deal of insight and innovation around, I don't think it's a panacea for all of the challenges that we face.
Thank you for the insight. Now, stepping away from the office for a moment, what book are you reading right now? What's on your shelf? And I'd love to know what has had the biggest impact on your career thus far.
Wow. So
Loaded,
the book I'm reading now is Power in the Middle. And so it's a book that was recommended by my president of the health system, Pam Sutton Wallace, around the power of middle management and the importance of it. Sure. So I read a bit on the flights out. I'm going to hopefully finish it on the way back. Most influential, I think, has been the relationships. I have been fortunate to have just tremendous relationships with mentors and colleagues And I think that has been the greatest influence on who I am and how I can evolve as a leader going forward.
As the CEO of Yale New Haven Health System, what do you love most about what you do?
I love everything, honestly. I tell my kids who are in that space where they're beginning to move into careers, and I truly embrace that saying that if you love what you do, you'll never work a day in your life. And I've been extraordinarily fortunate to be in this field and to work amongst the amazing colleagues that we have working in this field.
Wonderful. Well, we're so grateful for you, Christopher, for being here in Sioux Falls for our third Rural Health Summit. Safe travels home, and appreciate all that you do.
Thank you very much.
Thank you.
You've been listening to Reimagining Rural Health, a podcast series brought to you by Sanford Health. Hear more episodes in this series or other Sanford Health series on Apple, Spotify, and news.sanfordhealth.org.